This just in tonight on CSD News. The Zika virus, an epidemic sweeping the globe causing microcephaly, a condition that alters brain development in unborn children. What this means for the mothers, and how we, as a nation, can prepare for what's to come. The Zika virus, commonly known to physicians as ZIKV, is not a relatively new discovery. Previously contained in parts of Africa, Southeast Asia, and the Pacific Islands, the Zika virus found its way to Brazil in May of last year. Because it is primarily transmitted through mosquitoes, the virus thrives in areas with tropical climates. As a result, South and Central America have seen an increase in the number of outbreaks, which is expected to continue to rise as the Northern Hemisphere enters warmer months. There are currently over 40 countries reporting outbreaks, including the United States. Perhaps the most challenging and heartbreaking aspect of the Zika virus is the effect it is having on unborn babies. Pregnant women who have been infected with the virus are passing it on to their offspring via intrauterine transmission through the amniotic fluid. Mothers in areas affected will likely not know if their child has been impacted until birth, when a physical abnormality can confirm a diagnosis. The Zika virus has very recently been linked to an outbreak of microcephaly in the babies of mothers infected. Microcephaly, a rare condition that literally translates to small head, is primarily congenital, with some cases occurring during early infancy. The result is an abnormal brain development, usually originating in utero, which consequently leads to smaller head circumference at birth and throughout life. A proper diagnosis requires infant head circumferences to fall 2 standard deviations below the mean for both age and sex. And while the numbers for microcephaly range from 1 to 5 infants affected per 5,000 births, these numbers are expected to rise. Microcephaly can occur on its own with very minor consequences. However, it is usually accompanied by other major birth defects, including seizures, developmental delays, intellectual disabilities, feeding problems, hearing loss, and vision problems. These problems can range from mild to severe and are often lifelong. As a result, treatment is often dependent on the severity of the symptoms as well as centered on addressing any comorbidities. While there is currently no cure for microcephaly, treatment to subside accompanying factors can be of great help to families. Aside from the Zika virus, microcephaly is commonly caused by craniosynostosis, chromosomal abnormalities, decreased oxygen to the fetal brain, infections during pregnancy, exposure to drugs, alcohol, or other toxic substances in utero, severe malnutrition, or uncontrolled phenylketonuria. For more information about microcephaly and the Zika virus, we encourage viewers to visit the CDC website, especially if you are thinking of traveling to the tropics in the coming months, are thinking of becoming pregnant, are pregnant, or wish to enhance your personal scholarship. After the break, we'll dive into what's being called the discovery of a century, and later, how to battle frozen pipes this winter season. That's all for now.